behind the scenes with Major Lazer. Favorite artists like you've never seen them before. Released.
sasa ni mzee. Daudi kasema nilikuwa kijana, sasa ni mzee. Sijawahi ona mwenye yake ameachwa mimi, wala watoto wake kuombaomba mikate barabarani. Mungu ni mwaminifu kwa ahadi zake wanadamu. Mungu ni mwaminifu kwa ahadi zake, si kama wanadamu. Oh, akiongea Yesu ameongea, akikuahidia kitu Baba ameahidi na ujasiria atatenda kwa wakati wake. Yoyo ninamuita Bwana wa amani, ninamuita mfalme wa amani Bwana. Ndio maana mimi ninaimba kwa sababu ya amani yake. Ni uwezo gani unaompinga Yesu? Uwezo gani? Matendo yako yashangaza dunia. Haleluya. Usilie wewe, usilie. Bwana anakujua ndugu yangu, amesikia kilio chako wewe mama. Unalia nini kwa wanadamu mama yangu? Wanadamu hawatakusaidia na kitu, wanadamu hawatakuwezesha kwa kitu chochote wewe. Tunaye mmoja anaipanguza machozi ya watu wake, ni yule mfalme wa amani. Ni yule aliyesema yote imekwisha. Mambo unayoyapitia ni yeye anayeyaona, anajua shida yako mama yangu, anajua magumu yako baba yangu. Ukiwa na shida usiende kwa waganga wa dunia, ukiwa na magumu usiende kwa wafumu wa dunia. Muite mfalme wa amani, yeye anajibu maombi. Muite mfalme wa amani, yeye anajibu maombi. dunia nzima. Wanaokosa amani ndani ya nyumba zao uwape amani, wanaokosa amani ndani ya kazi zao uwape amani. Ni wewe Bwana wa amani ya Kongo, ni wewe Bwana wa amani ya Afrika. Amerika wanalia amani, tunawe Bwana mfalme wa amani, tunawe Bwana mfalme wa amani. Hakuna kitu kile kinachokushinda Bwana. Mfalme wa amani, mfalme wa amani, mfalme wa amani. Wewe ni mwema Baba, wewe ni mwema, wewe ni mwema Bwana wangu. Mfalme wa amani, mfalme wa amani. Wewe ni mwema Baba, la la la, wewe ni mwema Bwana wangu. Mfalme wa amani, mfalme wa amani, mfalme wa amani. Mfalme wa amani kwa nyumba yetu. Wewe ni mwema, wewe ni mwema Bwana wangu. Mfalme wa amani kwa huduma yangu. Mfalme wa amani, mfalme wa amani. Wewe ni mwema, wewe ni mwema, wewe ni mwema Bwana wangu. Mfalme wa amani wa Shekina. Mfalme wa amani, mfalme wa amani. Wewe ni mwema, wewe ni mwema, wewe ni mwema. Mfalme wa amani, mfalme wa amani. Wewe ni mwema, wewe ni mwema Bwana wangu. Mfalme wa amani, wewe ni mwema Bwana wangu. Mfalme wa amani, mfalme wa amani. Wewe ni mwema, wewe ni mwema, wewe ni mwema Bwana wangu.
A must-see music event.
We are Major Lazer.
Go behind the scenes with Major Lazer. Your favorite artists, like you've never seen them before. Released.
Hallelujah. Ooh, ooh, hey. Hallelujah. Ni rahisi kinywa kujawa na lawama tele.
We are waiting for everyone to finish taking their breakfast so that we can start. So in the next 3 minutes.
Hallelujah. Ooh, yeah. Hallelujah. Ni rahisi kinywa kujawa na lawama tele pale mambo yanapoonekana hayaendi. Ni ajabu sana namna moyo unahangaika, ajabu sana moyo unavyoonyesha mashaka ya kwamba japokuwa Mungu anaishi ndani yangu, kuna muda na hofu. Japokuwa Mungu anaketi kati yetu, kuna muda na hofu. Nakumbuka wana wa Israeli katika bahari ya Shamu, japo walikatiza katikati ya bahari kwa ushindi, kwa nyimbo nyingi waliimba na kumsifu Bwana. Lakini baada ya kuvuka na kuliona jangwa, yalibadilika mambo, manung'uniko yalisimama na kusahau muujiza alotenda Bwana mwanzo. Mungu nisaidie. Nikumbushe wema wako nisije laumu, nikumbushe ukuu wako wakati wa magumu, nikumbushe shuhuda zako ili nikusifu, niimbe wimbo wa sifa katikati ya machozi, niimbe wimbo wa sifa katikati ya machozi. Nikumbushe wema wako nisije laumu, nikumbushe ukuu wako wakati wa magumu, nikumbushe shuhuda zako ili nikusifu, niimbe wimbo wa sifa katikati ya machozi, niimbe wimbo wa sifa katikati ya machozi. Mungu nisaidie. Nisaidie kukumbuka Baba ya kwamba umenichora kiganjani mwako, kati ya wengi waliopo duniani, na mimi umeniona. Nikumbushe Baba ya kwamba ni wewe umeniponya nilipoumwa, ya kwamba ni wewe
Check mic 1 2. All right. This is the final call. If you're going to have breakfast, this is your time, or forever hold your peace. They say an hungry man is an angry man. So this is the final call. If you haven't had breakfast, this is your chance. Please walk to the left, have a cup of tea. Reggae is about to begin. And when you start, there's no stopping. All right? Final call. Everyone who hasn't had breakfast, kindly go to my left, get a cup of tea, and then we'll start the discussion proper in just a bit. The discussion is really very simple, all right? So there's the boardroom conversation about it. But the question really is how do we achieve a future-ready household? That is a simple conversation. And here's how I want us to conduct it. Take a scenario. in any place that you come from, any informal settlement or even a formal settlement. A lady in Kibera makes 50 shillings in a day. She walks back home. She has 4 children. What is she most likely to buy? Food, drinking water, or water to clean? And if those are the options that she has, then what alternatives are we offering as a people? Okay? We know now that the budget for this, and it is deficient, it is about 1.28 trillion shillings if everybody was to get access to clean water. Okay? We also know that only 15% of the population in sub-Saharan Africa have access to basic hand-washing facilities. You know, they say in God we trust, everybody else will bring verified data. I came with my data here. I'm not making up these things. So this is the reality on the ground. Just coming a day before the global hand washing, which is held every 15th of October. So this year's theme is hand hygiene for all. A call to action to make hand hygiene a reality for everyone. This is the reason why I gave you the scenario of the lady in Kibera. Makes 50 shillings, has 4 children. How then do we ensure she and her children have access and make hand hygiene a reality for them at this particular moment? Once we answer that question, we are home and dry. So essentially what I'm saying is this conversation is for all of us. At some point I'll be coming down there with microphones. I will request you to put your to have your masks on, because I'll hold the microphone for you, but you'll just give us your views on this, what you think is the solution going forward, because it is a collective decision from all of us. None of us has a silver bullet, but we are discussing, and we will find the solutions this morning. All right? Another final call, if you're going to have breakfast, my co-MC is here, Chipukize. Chipukizi, huko penye ulitoka kuna maji kweli?
Unajua sasa nyinyi mmekuja kusaidia watu wetu huko nyumbani. Let me tell you, Obinja, you know, in Ukambani, you wake up to look for water to drink, not for water ya kuoga. Ya kuoga mtaongea baadaye. Ya kunywa iko. So you can imagine. This is a nice.
Inachukua wiki ngapi hivi?
My friend, ya kuoga unajua sasa mnapanga mzee ndio ataoga peke yake kwa nyumba. You know, so this is a good conversation. I'm so excited. We're going to have the first segment with Obinja. I'm going to be your Datembea na mask. Wewe ni mdosi. You don't have to come huku chini. Kwa hivyo guys, let's have a talk. Tuongee tu freely and find a solution together.
Asante sana. So, I think I'll call upon the first panelist to come up. We are already a bit late, but I can assure you we will catch up on time. So what we're going to do is every panelist will come, speak about how do we ensure we have a future-ready household. They'll talk to me about and talk to all of us about what they think is the problem and what they think is the solution in under 2 minutes before the discussion proper begins. And I'd like to introduce them. I'll show you their profiles coming up in just a bit. My first panelist is one Dr. Kefa Ombacho. Dr. Kefa Ombacho is the head directorate of special programs at the Ministry of Health. Karibu sana daktari. He's been there, like he describes it, for donkey years. That's what he told us just a few moments ago. He has a wealth of experience spanning over 3 decades in illness prevention and health promotion. You can take a seat, daktari. Asante sana. And he has also overseen the implementation of WSSCC. He will tell us what that is. Don't worry, I told you. Mimi yangu ni kwa ground. Kizungu mingi, tutaacha tu. He will explain to us what that is. Programs in Kenya country since the organization was launched in November 2014. Dr. Ombacho has also contributed to the strides made in the WASH sector by implementing initiatives to improve the lives and livelihoods of communities around the country. That is the first panelist. A round of applause for him. Asanteni sana. The next one is Margaret Osolo. Margaret Osolo, karibu sana. A round of applause for her. She comes up. Thank you so much. She's an ambassador, One Young World. She is a global health advocate with a passion for science and extensive knowledge. She has also experience in programming in health and humanitarian action. Asante sana for making time for us as well. and she's also been awarded the 2019 Diana Award recipient in London, that's in the United Kingdom. A round of applause for her. Thank you so much for coming. All right, Francis Musinguzi is the next panelist. Please make your way up. He's the African Regional Director, water.org. Thank you so much. A round of applause for him. Francis leads the water.org strategy vision and water and sanitation program expansion in Africa. He's responsible for advancing the organization's market expansion and strategic execution across the region to cultivate partnerships. All right. Thank you so much. A round of applause for him. All right, and my final panelist for this particular session, where we're talking about the role of government in achieving future-ready communities, the final panelist is Mr. Mwangi Githaiga. Thank you so much. He's the Managing Director, KWFT. A round of applause for him as he comes up. Mr. Mwangi Githaiga has served in Kenya Women Microfinance Bank for over 20 years and has been key in championing microfinance industry initiatives towards financial inclusion. Thank you so much for making time. On the tables, there are sanitizers. You may wish to sanitize your microphones. It is okay. You can also just make sure they're on as we start this conversation, but I'll give each of the panelists just 2 minutes to give us their own perspective on how do we ensure that we're creating a future-ready community to save lives. I'm sure you've noticed that I've left myself out because my introduction is not as elaborate as my panelists. My name is Trevor Mbija, a journalist. Imeishia hapo. I know, underwhelming. But, so, house rules. We'll be walking down there, myself and Chipukizi. We'll give you a chance to give your views, your questions to the panelists once we have this discussion going. On my farthest right, down the stairs, is where the washrooms are in case you need to step out. We also want to welcome everyone who's tuning in live on YouTube, on Instagram, on Zoom, on Twitter, Facebook. The handles are IG at Dettol Kenya. That is the Instagram handle, Dettol Kenya. Twitter at Dettol KE. The hashtag is Future Ready Global Hand Washing Day. Wi-Fi password. We also have that so that you don't have an excuse that your bundles imenda wapi. We have that coming through. KICC Wi-Fi. That is the username. The password is KICC at 2019, and then you have double exclamation marks. KICC at 2019 and double exclamation marks. This conversation is about what is the role of government in achieving future-ready communities. What does that even look like? And I'll call upon Dr. Kefo Ombacho to come up. Your microphone is with you. Just give us a brief description of what you think that is, just 2 minutes. And each panelist will set the tone and we'll kick off proper. Thank you so much.
Thank you, Mr. Bincha. Good morning, everybody. Allow me first and foremost to appreciate the invitation to this engagement. I'm sure there could have been other possibilities on who would have been invited. So with a lot of humility, I thank those who have provided that attitude to be here. And I want to go straight to the issue that I've been asked to engage. Water, access to water, sanitation, and hygiene is very critical in matters of health. We are all aware that the bulk of the ailments or disease that we manage in our facilities are basically 40 to 50% preventable. And the bulk of it, if we give access to safe water, hygiene and sanitation, I mean, we are done. So we just only go to other a bit of communicable that are not water related. So we are discussing a subject matter which is so critical in trying to improve health status of our population at any given time, and more so for developing countries. In particular, I would want to connect it with the current pandemic that we are having. If anybody didn't value the value of safe water access, hygiene issues, and sanitation, this should be able to remind you. That doesn't mean that we have not had diseases and ailments which are actually connected with these issues. But by and large now, we are aware that if we observe, and if you look at the Ministry of Health and the other countries' measures, they are all around that place. And if that is done, forget about the sanitizers that we are given. If we have access to safe water, soap, any soap, and we change our mindset into having the practice in washing our hands, will be good. In fact, our quick assessment currently in the country in terms of disease, the morbidities in the hospitals, we have realized that we have substantially reduced the ailments or diseases that are actually having a connection to poor sanitation, use of water and soap in this country. That has been done. So what are we talking? We are actually talking about issues of access. Access is so critical. And I want to connect it to what the moderator was telling us about Kibera. Historical, if some of you have had an engagement and maybe visiting Kibera, some times back, Kibera residents were paying for water more than I pay. There was a deliberate move to have water, safe water, being given there. And of course, we are aware that there were cartels who were actually denying them the access. So a deliberate move, maybe before I go to that, let me just say this. What are countries required to do? Countries meaning including where we are in Kenya. The countries are supposed to give an enabling environment for all those who are actors in this sector to be able to willingly and freely participate in this subject matter. So what is required? One is the policy. There should be a policy outline which gives equal rights of stakeholders to be able to engage and engage at almost par. Obviously, the governments are supposed to be providing leadership and coordination purposes on this. Maybe another thing that, Ombija, you didn't know, I serve at the global level as a chair of the government initiatives that the sanitation and the water for all. So if you look at most of the documents and the resolutions that have been taken globally, governments have been asked, there is a role governments are supposed to be playing. I'm happy in the context of Kenya, I'm happy to present to you that most of those have been given. The policy directions have been given, and they are there. You can read them. If they are not available, we can give you copies, hard copies or soft links where you can get. So, and forums have been provided where engagement is made with private and public sector practitioners. Now that brings me to issues of, if we get access, then we must have the quality. And if we have the quality, we must have equally the right quantities. But overall, the policy direction directs us that we must form strong partnership. The partnership is going to be between the public, private, and the beneficiary. Many times we forget that the beneficiary doesn't have a voice. He has a voice or she has a voice. So as I was talking, I'd actually digressed to go into Kibera. Now, what were the problems that we had in Kibera? Some years, not very long ago, by the way. Access to only water. We are not even talking about safety. We are not even talking about quantity. Was a nightmare. And as I said, Kibera residents were paying more for water. They were paying more than some of us pay. And the same was, there was almost zero access to issues of waste management. That is the sanitation, because you cannot, as much as even if you had all the information and the knowledge, if the provisions are not there, you cannot be able to manage it. So the access to safe disposal of wastewater, including soil water, was a nightmare. But we are also happy to note that there are, through some initiatives, government initiatives, we know that in Kibera, there was a provision for a sewer line. And also there was provision for water, the stands of water. Now, that made it a bit cheap, I can see. So let me just go to this. Now, once we have the access and the quantity and the quality, then we must look at two issues: sustainability and a strong partnership. Thank you so much.
Round of applause for him. Thank you so much for that opening remarks. I'll call upon Mr. Francis Musinguzi. Very brief opening remarks, and then we'll start the panel discussion proper and also include our audience as well. Very briefly.
And thank you, Doctor, for those remarks. And good to have all of you. It's an honor to be discussing something that sits at the heart of people, and especially our own African people. I think Doctor has given a very good background that the issue of water and sanitation cannot be more than emphasized, especially even with what COVID has showed us, that this is what would give us resilience. But we do understand that many discussions have happened around this provision of water and sanitation. We've had many policy discussions. We've had many desires from the users, the citizens. But the question is, where is that problem? Where is the elephant in the room? There are many different ways to tackle that elephant in the room. There are 9 building blocks, starting from the policy, regulation, accountability, how we monitor, service provision. But the biggest challenge we have is on financing. And as water.org, for 25 years, after studying the different blocks that do affect water and sanitation provision, we noticed that unless this challenge of financing is tackled, all we are saying will keep as dreams in the air without foundations. The World Bank did a study and saw that we need $114 billion US for us to be able to meet the current gap for water and sanitation provision. $114 US. And when you see, add together all the money that is being raised towards water and sanitation, it is 24.4 billion shillings. So you can see the huge gap that we have for financing water and sanitation. The huge gap we have to meet the current population we have in Africa of 1.216 billion people. And if you want to look at Kenya, the 53 billion people. So this gap that we have in financing clearly shows us that all of us need to think of new and innovative ways of covering this gap. Many years we thought, this is the government to cover this gap, and we all looked at what we call public financing, the money that comes out of the budget. Kenya's budget is 3.08 trillion shillings, and we said maybe that's the money that will cover this budget. And then after many years, especially here on this side of Africa, we started looking at aid. Maybe we'll get money from the World Bank, from development partners like Water.org and UNICEF. And all this development aid has still run short of covering the gap. And finally, we have said, no, we all need to come together and begin to look at the place that private financing plays in covering this gap. And as we begin to look at private financing, it begins to ask us to bring all partners together, to bring doctor from the government and begin to see his role in policy and regulation, to bring banks like my brother here and what he's going to speak about, to begin to look at a household. This lady in Kibera who faces this challenge of water every day. This young girl out in Kisumu who is walking 3 kilometers to look for water. Can she contribute to cover this gap? So we've been coming together to see how we can unlock all this capital that will be able to help us to cover this gap of water and sanitation. Therefore, as water.org, it is our privilege and honor to see that RB Deto has come to bring us together in this round table to appreciate that public finance, donor aid cannot be enough. We need to look at the role and the position of the private sector as pivotal in covering this gap of water and sanitation. Thank you very much.
All right, a round of applause for him. Asante sana. Mr. Mwangi, very brief opening remarks, and then we get into the elephant, like he calls it. How do we ensure people have access to clean water?
Water issues are serious household issues. They are issues that have to be addressed. The women have to be liberated and they have to be put in a position where they are engaged in more economically active, issues than just converting them to be going to the river, fetching water and bringing it to the household. So when we, as an institution, we went for women empowerment, water became a key issue, among others, because women spend a lot of time all over this country, not only carrying water on their backs, which is detrimental to their health, but also they have no time of their own to be able to engage in any other activity other than fetching firewood and fetching water from the rivers. Now, after you've done that, then we talk about the quality of water that we are talking about, and then we can talk about the quantity. But the issue of access to water is a key issue. And if you think about one of the biggest challenges we have as a country, which is rural-urban migration, and ask yourself, why do people move from the rural areas to the urban areas of this country? More often than not, they are looking for opportunities, they are looking for better living standards. But in the end of the day, when they come, like we have been doing by that time, they end up in the Kibera, where the situations and the ways of life even becomes worse than they had when they were in the rural areas. So as a country, as a government, we need to put, and also private sector, we need to put our money where our mouth is. We need to put the money where our mouth is. We want the quality of life to be improved. And like Daktari says, you can't talk about health unless you talk about water. Because water is life. Water is life. Even the milk we take, health, we talk about water. So it is very important for government and private sector to partner. Government creates an enabling environment, and private sector invests in water solutions. So as an institution, what we have done is we try to make sure that we harvest water, because unfortunately we have a lot of water in this country. It rains every year, but all the water goes to the Indian Ocean. Then immediately after that, we start trekking, looking for water. So you need to invest in water harvesting solution, water conservation, and also water purification system. And that's what we have done. We've been working on it for the last over 20 years, and we have seen the standard of living improve across the country. I do not want to go too deep in it, but I would say that unless we address the issues related to water, we cannot be able to address health issues. Thank you very much, and I look forward for even more deeper engagement on that line. Thank you very much.
All right, thank you so much. All right, now Margaret, your turn, very shortly, and then we get into the discussion. Yeah.
Good morning. My name is Margaret Osolo. I am a global health advocate, but mine today is to be able to achieve global health equity and to be able to achieve global health security. We actually need to start with water, sanitation, and hygiene. So mine today is how are we able to assist the 13-year-old girl who is living in the streets in Grogon, be able to access safe water for consumption, one, and safe water for menstruation, safe water for personal use. How are we able to reach out to people who have been affected by humanitarian emergencies? For example, the 16-year-old boy who's living in a tent in Garsen County. How is he able to get water for drinking? How is he able to get water for basic hygiene practices? How is he able to get that water for other personal use? So for mine today is how are you able to, as a community, as stakeholders, as collaborators in this space, can we focus in much more investments on water and sanitation? Can we be able to focus on better integration of the efforts that are there? So much has been done, so much is being done, and especially during this COVID and past efforts to prevent, for example, the cholera, Ebola, and other preventable infections. How are we able to integrate all these efforts from various sectors, from the finance, to the environment, to education, to food security? How are we able to innovate and find much more better and cost-effective structures to reach each and every individual? So mine today is being able to integrate and bring on board especially the most vulnerable and the most marginalized populations to these discussions, that in 3 years from today, people will be able to know that there is a global health, global hygiene and global hand hygiene day, that we're able to build momentum and able to at least make commitments to make sure that we're able to prevent deaths that are from infectious diseases. Thank you.
All right, thank you so much. So now we get into the discussion, and we'll have the podium moved so that you can see all of them very clearly. It's going to be very basic. We already know that we have the policies in place. We already know from Dr. Ombacho what he has just said right now is that the infections have gone down, infections related to hygiene. But Dr. Ombacho, then where is the problem really? What should we do differently? Because we know these things already. You've said the infections have gone down. We already have the policies. But how come we don't seem to be having the magic bullet? Where does the problem lie?
Thank you very much. And I want to make a very slight correction. The infections have gone down based on the recent practices in observing the measures. But that doesn't necessarily mean that that has been the trend. How we wished that even with this scare of the pandemic, people will be able to actually adhere to that. Let me come back to your question. The question is, where has things gone wrong? I think the things have gone wrong because of our mindset. I think we need to change our thinking just slightly, and the thinking will affect the practice and the attitude. So that's where we're having a problem. I want to say this, that surveys have been done and we have got data. We want to appreciate that people could be poor, being poor is relative. But we cannot, and we have got data to that effect, that all of us have got at least some access to some water. We also know that all of us, we have got access to some kind of shop. So what we are actually having a problem with is the change in the attitude and the practice. That is the hygiene part of it. That's where the big problem is. Of course, there are other supportive issues like colleagues have said here. You can change if there is no continuous quality. That can also be an issue. And maybe with time we'll discuss about this elephant, which has been raised to be a problem. Yeah. And we see how we can cut it into small pieces, and maybe we get a solution.
All right. Mr. Musinguzi, in fact, you're the one who brought up the elephant in the room. You mentioned the budgets being 3.08 trillion, and then there's a budget gap of about 1.2 trillion shillings, which is close to half what the country's budget total is. So how then do we achieve a future-ready community to save lives and build on the momentum that has been created by COVID-19?
Thank you so much. Thank you so much. Indeed, as Doctor said, when we look at the challenge that we have at hand, is the big question is that do we need all these billions from government or from donor aid for us to cover this financing gap? And we're saying no. The solution is with this lady in Kibera. The solution is what Margaret stated. In those small households, those communities we have, they are able to cover this financing gap. And my brother, Dr. Mwanji, when we were discussing over breakfast, he said something interesting. He said, for us men, when you talk about a problem or a challenge, men will always think you need billions of money. But the women actually know that if you just have 1 million and add another million, very soon you'll have a solution. The 1.2 billion people in Africa have solutions to this problem. We have looked at Africa as a problem continent, but today and this morning we come to say, no, the narrative must change. Africa has her own solutions. The 1.2 billion people that we have in Africa are able to meet this challenge. And how? By us coming together and understanding that water.org cannot run alone, the government cannot run alone. We need to now bring the private sector, the banking, the finance institutions, as pivotal in solving this problem. That the small loans that we get from the Kenya Women Microfinance Bank are enough if people are made aware out there and are able to pick these loans and buy a water tank and begin to pay back. What about those who are not able to find guarantee? Go back to the government. That the money which the Kenyan government is investing in the highways and roads, they are good, but could be used as a guarantee for some of these people that cannot pay back, or a water utility service provider that cannot pay back that guarantee. So the whole issue of the elephant in the room is seen as a huge animal, but we can split it, as Doctor has said, and begin to realize that with small loans for water and sanitation, we can empower each household to be able to meet their own solution. Thank you.
Dr. Mwangi, speaking from the banking industry, what are the quick wins? How can it be done? We are saying that how do we break down the elephant and ensure the mama in Kibera has access to clean water, and she doesn't have to make the hard choice between buying food for her family and getting water?
Thank you very much. I think the biggest problem we have is that we try to bundle our issues so that they look very big. Yet they are very, very simple issues. If you go to the rural area, and you find, because that's where part of our access to clean water is a big issue in the rural area. When you go there, what do we and you give them a water tank, access to a water tank, they immediately, because Kenya rains, that's like Kenya shines, and we are still having energy shortage, yet there's a lot of sun out there. If you look at the amount of water that flows through River Tana to go and flood on the lower side, and which can be trapped and preserved in water plants, simple solutions. But when we think about massive dams, why don't we create solutions at the household level and break our problem into small pieces that can be addressed at the household level? And I'm telling you, that's where the solutions of this country lie. The problem is we overthink, we conceptualize, we borrow unnecessary ideas from other countries. We do not solve our problems, we solve other people's problems. That's where the issue is.
So we need to sort of customize our needs. And Margaret, you were speaking about this. We can't completely absolve the government from it, right? We're talking about the role of government in achieving the future-ready communities. How much support have you gotten? Because I know you deal with the vulnerable in the community. And what options are there from the government's perspective that you wish would change into something more tangible?
So we've had a lot of support in terms of programmings from the government, being able to get resources, be it tangible or in-kind support. But I think one thing that is very key is we have programs that are coming on board, but the question is this program well tailored to be able to address a specific issue? So currently, at the moment, if you go to Lamu specifically, there is a set of toilets and hand washing facilities that for the past 7 years have never been used by the community members. If you go to Voi, there was a hand washing facility and there was a water treatment center that was actually set up for the communities to use. But even till today, they have never been in use.
Is it because there's no flowing water, or is it because it was set up in a place that they can't get to, they can't relate to that plan? Why is it not being in use?
It's not being in use because first, the solution, for example, first they do not understand the cultural context, why the women in Lamu are not using toilets per se, or what is actually in the ground. So I think the first thing that needs to happen is when we are actually sitting down to come up with programs, can we be able to go down to the communities, involve the communities, have a very vigorous public participation, bring on board the women, the children, the young people, the people living in disabilities, bring them to the table, have a sit down with them, let them come up with the various needs. What are the needs that are there in the communities? What are the gaps that are there? So when it comes to designing the programs, let them co-design it with you, not just coming up with solutions that are not even well tailored to meet the problems in the communities. So first, have them on board, and if you're setting up such a program, have a multi-sectoral or a multi-stakeholder collaboration, so that if we have the people from finance, if we have learning institutions or research institutions, if we have people from the food sector, then you're able to come up with holistic approaches to solving quite a number of issues that are there in the community. And especially when it comes to something as basic as hygiene to prevent diseases in the community. Yes.
Dr. Mbacho, before I open the floor for remarks from the people, I'd like to hear from you. There seems to be something that's coming out here, that the policies that the government seems to be coming up with does not relate to the people they are supposed to even help. How do you come up with these ideas? How do you come up with the policies? Do you involve the people who they are targeted for?
I think all of us and Kenyans, when it comes to matters of law, their antennas are up. I totally agree with what she's saying. Giving solutions which are actually not connecting well with the beneficiary. I mean, that is elitist, it can't work, can't be sustainable. You can only have, historically in this country, when we were building the ventilated, improved ventilated pit latrine, nobody used it. Because again, here is somebody who has got a grass-thatched house, and you are coming out with a stone, iron roof. This can only be a very good store because it's safe. It can't be a toilet, so people will use it as a store. So, but I think it is a lack of being in a hurry to do things. As I said, stakeholders' participation is a constitutional matter. Everybody knows. Anybody who cares knows that you cannot go to a place and start doing something without involving people. People must be involved so that you get it from a very remote way, what is their expectations, and make them work with them and make them to appreciate that you have taken the idea, it can only be done this way for purposes of improve it, and actually explain why you are improving. You cannot just improve something and just assume that guys are going to have it. It can't.
All right.
So I think it is us also who are driving the policy, who are driving the project formulation, who need to be serious in following the laid down milestones in whenever we are doing this.
Okay. I'll come back to my panelists to give their final remarks on how then do we create future-ready communities to save the lives of Kenyans. But now I'd like to hear from maybe one or two of you what you think the role of government should be. And earlier on, I was speaking to one Anthony Githinji, I think, and he told me outrightly that the government cannot be expected to fund all the water issues in this country. He was very explicit to that. I'd like to hear from him why he made that statement and what he thinks is the solution. Anthony? There he is. He's over here. Yes. And then you can also just raise your hand and we'll make sure the microphone gets to you before we come for the final remarks.
Thank you and good morning, everyone. As has been alluded by the panelists, we know, of course, there are gaps in terms of financing for water and sanitation in the continent. And we know, of course, government budgets are constrained, given that there are priorities in terms of politicians. So my point was, what needs to happen is that the government needs to create an enabling environment where private sector institutions like banks, manufacturers, and others are taking a space and playing a role. But the government also needs to organize itself because, for instance, the Ministry of Water handles water, the Ministry of Health handles health, but there's some lack of kind of coordination in terms of how they present the issues of this sector to the finance ministries or to the cabinet. So we need to see a lot of that in terms of government enabling environment and policy issues, better coordination around that, and more sort of one voice that says, these are our issues to the cabinet, these are our issues to the parliamentarians, and create that enabling environment, because we've seen evidence in Kenya that if you give the private sector a chance, they will come and help us solve this problem of SDG 6. Thank you.
All right. Is another remark over there or question? Yes. Questions, remarks are all welcome. We'll sanitize the microphone before it gets to you. All right.
Good morning. My name is Kinyanjui. I work for Kenya Women Microfinance Bank. My take would be that, and I would look at it from a value chain angle. We need to look at the water value chain from the beginning to the end. I also want to think that we need to focus not only in Kibera. We need to focus on a client who is in Turkana, out there, who is looking for water. We need to think about how did the government entice the private sector to ensure that the client who is there can be able to get water storage facilities like a tank. That we need to think about as a government. And what Githinji has said, I agree. We need not to look at it in isolation. We need to look at it in wholesome, all of us, all the stakeholders who are involved in the water value chain.
So do you think tax exemption for water tanks and things like that would help?
That is what I'm talking about. That's what I'm looking at. Those are the issues that we need to look at. That if we have this supplier of tank who has to take this tank from Nairobi to Turkana, how does the government motivate the supplier to be able to deliver that tank out there? Because if you look at the logistics of transport costs between here and Turkana, the differential is very high.
It's the same cost
when you
as
compare
the
with a customer who is in Nairobi here.
All right. Thank you so much. So the men have spoken so far. We are aware that when they're given a chance, they only ask for shopping centers, but the women ask for water and sanitation. Can we get a lady to give us their view on what they wish the government would do differently to ensure people have access to clean water? What do you wish the government would do differently from your own view? Can we get a lady? There you are. Yes.
Thank you very much. My name is Mary Gonjiri from water.org. I also want to really support what my brother Kinyanjui has talked about, looking at the value chain, thinking about the fact that the government alone cannot be able to support everyone in this country with water, and therefore we have the space for private players. What support are we going to give to those enterprises that are coming up that support in terms of extending water? For example, we have the water utilities that cannot be able to give everyone water in this country. And we also have enterprises, private entrepreneurs, who are able to connect a few households. How can they be supported and encouraged to be able to reach the rural fraternity with water where the government cannot reach, or even the informal settlement? So it's about encouraging and motivating the entire value chain so that we have the government and we also have the private sector coming into play to ensure that everyone in this country has access to safe water and sanitation.
All right, thank you, Mary. Now I'll come to my panelists for the final remarks, and Margaret, I'll start with you. Where do we go from here to ensure that we create a future-ready community to save lives? What would you like to see from government? The one thing you'd like to see from them going forward?
So mine is simple. One, incentivize the process, the wash processes, so that to facilitate access to water, to facilitate availability of hygiene products, incentivize the process to facilitate literacy on health and hygiene, and especially amongst children, young people, and also people, because most of the time there are people we overlook when it comes to water and sanitation. One is people in the rural settings, people living with disabilities, because and initially, even when COVID started, we had so many messaging, targeting messaging on COVID, but we actually forgot people with disabilities, people who cannot hear, people who cannot see. Then how are you able to reach these people with information on water and sanitation? How are you able to bank on the existing structures to facilitate access to water to people, depending on their space, the place where they stay, or where their socioeconomic status. And also, we can also try to facilitate more innovation, more innovative approaches to be able to facilitate access to water. Because you've seen, when the COVID started, we've had so many innovations that actually came on board to facilitate, to fast track issues on water and sanitation. So if you're able to incentivize all this process, on bank on the already existing structures, I think we'll go far.
All right. Mr. Mwangi, what is the silver bullet from where you stand?
Thank you very much, Trevor. Well, I was looking at the theme, creating future-ready communities to save lives. First of all, the communities have always been ready. It is us who do not have solutions to their needs. What we need to do is to create appropriate solutions to the community needs. The needs are there, they are known, they are simple needs, but we need to address them with solutions that are simple to deploy. And I think, the question is, what can government do on this, and what can private sector do? I think what government needs to do is not offer any service. What we need the government to do is to create an enabling environment. And one of the issues is when the government wanted to push solar energy, they removed taxes on solar panels. Then if you want to push water solutions, and we believe water is key to life, then remove taxes on water solutions like water tanks. I think if we address those simplistic things, then we don't need to invest in mega projects. Those are the areas that we need to deal with. Simple, scalable solutions that can be put at the household level, that can be able to be multiplied, and then solve the problem in the years to come about moving a water tank from here to Turkana. Those are the issues that we need. We need to break our problems in small, digestible parts. And then after that, offer solutions.
All right. Mr. Musinguzi?
Thank you so much. I would like to first of all start saying that the only way to tackle this elephant in the room is to break it in pieces.
Yeah.
And I want to thank Deto for bringing us together. Because this is rare. It's the first forum where I've sat that the private sector has brought us together to discuss the SDG 6 issues of water and sanitation. So thank you, Deto. And just like to say, as Mr. Mwangi has said, for us to be able to connect the dots between people, between partners and ideas, is that the poor, the people we call the poor are able to pay for these services. In fact, we did a study, and it shows that the poor people pay more for water and sanitation. Somebody who has a house here in Nairobi, getting water from a water utility, pays less amount of money per jerrycan than somebody who is in the slum. So that means that all we need to do is to break up what is that barrier, break it down, and say, let us advance this lady up to there in Kibera to make sure she can pay upfront for that water tank, so that she can be able to pay a loan over a period of time when she's accessing water within her home, when she's able to wash hands using Dettol within her home. And how does that happen? Thank you very much. How does that happen? That is where we all need to come to. Financial institutions like the Kenya Women Microfinance Bank is given that seat and that platform to connect that dot, that we can have private financing accessed, so that everybody who is not in the reach of water and sanitation services can access them and be able to pay small loans gradually. Thank you.
Okay, thank you so much. Dr. Mbacha, I'll give you the final remarks on this, because you'd alluded to the next segment which we're getting to, the role of the community and the individuals when it comes to creating a future-ready community. But your closing remarks on this, what is the take-home? Where do we go from here?
First and foremost, I want to appreciate the engagement that we have gotten. I want to say that maybe we are again reminded that indeed, I want to confirm to you that we had actually requested for tax exemption for the tanks. Maybe what we need to do is to follow it up. Now, I am also happy to note that people are sensitive about all sector planning. Indeed, the government now plans in blocks based on sectoral. And I think we are aware that each sector affects another sector. So I think I like that. Now, we must be reminded that the gaps will continue to exist, because we know that the populations and the projections are there, so those gaps will be there. The issue of access vis-a-vis subsidy, we all know that over-reliance on subsidy also has got a very serious effect on issues of sustainability. I'll beg that we engage our people to be self-sufficient as opposed to be people who are dependent. I will request with a lot of humility. I am sorry if my reference to Kibera was seen as that's where we are engaging. No. Our constitution requires the government to look at issues of equity. Turkana, Busia, Ramu, all those places are supposed to be looked at. And in fact, the constitution puts the responsibility on government to be able to do things for its population. Now, as we go, I think wash issues will remain a very critical thing going forward in many, many years to come. And we must attempt and make a deliberate move to be able to access and remain focused on it for purposes of sustaining the gains. By the way, strong engagement with partners and stakeholders will be the in thing that will maybe take us there. Now, a call for colleagues like Dettol and others who have been able to engage during this COVID pandemic for providing wash hand facilities. How I wish if I can convince you to continue expanding and sustaining it for many, many years to come. For fellow Kenyans, I wish you would agree that some of these access utilities are for the common good, not for you to vandalize and sell just only one component for that day. Thank you.
Thank you so much to my panelists. A round of applause for all of them as they go down the podium. Asanteni sana. Just kindly leave your microphones there. It is okay. We'll sanitize them. Dr. Kefa Ombacho, asante sana for coming through, the Head Directorate of Special Programs. We hope you can stay for the next session, because the next session now is the role of the individual communities in achieving the future-ready communities. Dr. Kefa, asante sana for coming through. Margaret Osolo, Ambassador One Young World, thank you so much for coming through as well. Francis Musinguzi, Africa Regional Director, water.org. Thank you so much. And Mr. Mwangi Githaiga, Managing Director, KWFT. So now the next segment, I'm going to call upon my panelists to come up as we sanitize their microphones, but it's going to be an all-encompassing conversation. So this time we're starting it the other way around. So my panelists will be here, but we will start with you down there so that you tell us what you think your role is and what we can do to ensure that we have future-ready communities to save their lives. Kwa ground sasa, what is your role as a person to ensure that you have enough water, sanitation is maintained? We've already been told now that the infections have gone down based on how clean people have been over the time. And we've also been told that henceforth, the communities should have policies that relate to them so that they can be able to take up those issues. We also know that people who are joining us online will be taking some of your comments in just a bit. We mentioned that the hashtag is Future Ready or hashtag Global Hand Washing Day. Our Wi-Fi password is KICC at 2019, !! I'm just cleaning up all the microphones so that we get in the next panel for this discussion on the role of individual communities in achieving future-ready communities. In fact, as we clean up those microphones, we can even start from down there. It's going to be a very brief discussion. It's open for all of us, and it's going to take just about 20 minutes or so, and then we close up on the discussion. Who will go first? What do you think is our role as a people in ensuring that we have clean water access? Also, kwa ground sasa, what do you think should be done differently? Let's see by raise your hand if you have a point over there. Let's see what your point is over there. All right, let's start with you.
Okay, my name is Paris Kimotho. I coordinate water and sanitation hygiene in a sub-county called Dagoretti, where we have some of the informal settlements. And I feel the role of the government has tried to really give access. But the backbone lies with this person we are providing the water and sanitation facilities for. The acceptance is a concept, is an aspect. And the issue of sustainability. As Dr. Kefa said, you provide a hand washing facility, then someone vandalizes it. So you cannot continue providing. So the individuals or the community should embrace and know that this is for the good. They change their behavior and their mindset towards whatever has been offered to them, and also prioritize wash issues. Yes, thank you.
Okay, so it's a change of mindset. Okay, let's get another view over here. There's someone here. Yes, just raise your hand where you are, then we'll talk about the role of the individuals now, qua ground. Yes, go ahead.
Good morning, my name is Aduyu Abeid. I coordinate also WASH in Stare, including Mukuru informal settlements in Stare sub-county. So the issue of WASH in communities is a very big challenge. But for me, I look at the target group. Who are we targeting when you're going to implement some of these projects, especially WASH? Because they normally say, if you want someone who can kindly pick the lessons, we target the young ones, because the young ones are normally pick the lessons very fast. In relation to the current situation, the COVID-19, it has been very hard for us to explain to people why it's important for them to wash their hands. Because maybe initially they were not taught the importance of washing hands. So targeting the kids as they grow up, they really pick it and they emulate it as they grow up. Okay. So for me, I really see we target the young generation so that as they grow, they can as well pick these lessons.
Teach them while they're young. All right, thank you so much. Any other remarks before I call upon my panelists? Yes.
I think in the communities, and like the earlier speaker has spoken, beyond coming from the government, within the stakeholders, we may need to get to recruit WASH ambassadors. These are opinion leaders from the communities that we work with, and they are the people who are steering this agenda on WASH. So that, I think, would help to take this project to the next level.
Okay, so we create ambassadors. Okay, let's get another one, final one here, before I call upon my panelists. Okay, I see there's a lady behind there.
Good morning. My name is Anastasia Kimoli. I'm a public health officer. For me, I work with the community. The government is able to coordinate these services from the community level. When you provide good information and adequate knowledge to the community, they will be able to maintain the facilities provided. And we have partners from the communities, from within the country that can support projects to the community.
Okay.
Thank you.
All right, thank you so much. So let me call upon my panelists so that we continue with this discussion like we had mentioned earlier on. Dr. James Gaduki is the first to come up. Kindly make your way up. Asante sana. A round of applause for him. Dr. James Gaduki is a health practitioner. He's in the healthcare, he's specializing as a medical consultant in Nairobi. Thank you so much. You can pick whichever seat you like. He's a pediatrician with a particular passion for democratizing access to healthcare for children, for less privileged backgrounds. Asante sana for making time. Then let me call upon Victor Odhiambo, Ambassador, One Young World. A round of applause for him as he comes up. These are the people on the ground who make sure there's access to water to the underprivileged. Victor is a founder of Garden of Hope Foundation that is started in May 2014 to develop the skills of underprivileged young people living in the Kibera slums of Nairobi. The foundation has worked with more than 5,000 young people so far. Let's bring in Mr. Michael Mutuku. Mr. Michael Mutuku, where you are, thank you so much for coming through. A round of applause for Mr. Michael. He's the CEO of Mlolongo Water Supplies Limited. He's an entrepreneur who focuses on empowering communities with access to safe water. He will tell us what the challenges are in trying to ensure that the communities have access to clean water. And a man who needs no introduction, the best teacher, the world's best teacher 2019, one Mr. Peter Tabichi. Thank you so much for coming this morning to be with us. Peter Tabichi is a science teacher and the Keriko Mixed Day Secondary School in Pwani Village, a remote area in rural Kenya. He will tell us what the issues are there. In 2019, he was awarded Best Teacher in the World at the Global Teacher Prize Awards and the UN Person of the Year for his dedication. Thank you so much for making time. Your microphones have been sanitized. This is a very open discussion for us. What is the role of the people? And Dr. I'll start with you. How do we change the mindset? Because there seems to be an issue around mindset of the community. Somehow they have access to clean water, but the mindset of conserving that water in the era of climate change, how do we ensure that they actually do it and ensure there's clean water for their families?
Morning, everyone. I think one of the best things about an interaction like this is we can allow each other to see that big picture, you know, like the gentleman before us said, that we are now dealing with an elephant that we need to cut up into small pieces. For a lot of our communities, the link between health and sanitation is not clear. And like there's someone who's just said now that it's been very difficult to push the message of hand washing because we didn't do it before. In fact, other than Dettol, no one has made it part of their consistent messaging in terms of just how important hand washing is for health outcomes. Yet in this country and globally, especially in countries where people pay their medical bills out of pocket, the leading cause of bankruptcy is medical bills. My interest is pediatrics, and 50% of hospital admissions are caused by diarrhea and vomiting. And diarrhea and vomiting, the long and short of it is sanitation. So if you have poor access to sanitation, you're not washing your hands, you cannot use a clean toilet, you cannot discard of sewage, you're going to have contamination of food and water supplies, right? So if you're saying that half of all hospital admissions are caused by lack of water and sanitation, and that in this country, the #1 cause of bankruptcy is medical bills. It means that actually our people are poor because they cannot access water, because they cannot access clean facilities, because they cannot access, like waste disposal, sewage disposal. So if we approach it from that, even from a community perspective, there'll be ownership, because they'll realize, hey, wait a minute. Are you saying that if I get my children to consistently wash their hands, because fine, you'll offer them the finances, but why will they take it up? I mean, all of us right now, if you go to your phone, you have access to funding. You can go to, your bank will give you a soft loan for whatever it is, but why will you take it up? Why will our communities be willing to take on the burden of providing themselves with water and sanitation if they're not seeing the benefit of it? You see, one thing that we are very lucky in this country is, in this COVID time, is everyone has been consistently on message. We haven't had a situation where, like, look at the panelists today, that some came without masks, others came with masks. Some came and looked at the sanitizer here and put it on the floor, for I don't do things like that. We have been consistently on message, and surprisingly, that might be the thing that has allowed us to stay ahead of coronavirus. You've seen countries in the world where different parts of their leadership, the church, the opposition, the government itself, government agencies, they are speaking a different language. If all of us are speaking the same language, that hand washing is actually a poverty eradication device.
Yeah.
If we are consistent in that, we can reduce hospital admissions by simply making sure that our communities have access to waste disposal.
Yeah.
That it is not maybe, that if our children are drinking clean water, there will be a better workforce tomorrow. So that even from a government perspective, because you see, if the government is paying school fees, but these children are not healthy and their outcomes are poor, in another 3 generations, we will have people who can't work because all of them have been drinking dirty water. So I think it's allowing our communities to see the link between their social, economic welfare and water.
Okay.
And then we'll succeed.
Victor, where is the breakdown? Is it that we are so hard-pressed dealing with other economical issues that we don't see the need of investing in clean water?
Good morning. Good morning. Thanks, Trevor. Let me paint a picture for us. And I'd like to appreciate the fact that Dr. Kefo Mbachu is here, very, very active. This is the month of October, and what usually happens is that we have the International Trade Fair, Nairobi Trade Fair. And Kibera has been mentioned in this conversation like 9 times. Sometimes you wonder, can something good come out of it? Yes, I came out of Kibera. The conversation is, every time there's Nairobi International Trade Fair, Kibera residents do not have water. And for a whole week, that happens. That's the first scenario that I like to paint. So for a whole week, we have to walk several kilometers. That, there's challenge as far as water is concerned. The other thing is that you just walk down the railway line, you see a very beautiful estate. And then just across the fence, there are kids playing in the same water that drains out from the estate, and there are women and girls washing clothes with the same water that comes from the estate. Community have structures, and the conversation that you should be having is, how do we build on these structures to support the households in these particular communities? We start conversations, we build water stations, we do all these things, but really we do not go back and say, what are the systems that already exist in these communities? So when you are, technology does not work, you blame the people, but in real sense, your approach was not really a very good approach. So the first thing that I would like to recommend is, in order for us to really ensure that the people implement the intervention that we're developing, is to work with the existing structures in these communities. The second thing I'd like to say is very simple, is data. Is how do we break down SDG 6 to a woman or to a lady who earns 20 shillings a day? What is this SDG 6 in the first place? How does it concern her? Okay? But when you come, we say SDG 6, access to quality water and sanitation to everyone. But really, how do you break this down to that lady? How does it really concern her? Instead of using these big words, is our messaging should actually be able to fit that lady, that household that actually earns 20 shillings a day, and they are torn between buying food and getting clean water.
Yeah.
Lastly, I'll also like to mention the fact that these households that we're talking about is that you find in a family of 5, they could be using 20 liters of water in a day, okay? How much does it cost them to use these 20 liters of water in a day? When you build up this infrastructure, when you build up these systems, have you gone to the household to find out is really how much do you pay to use these 20 liters of water in a day, okay? So data is very lacking and information. Okay? So when we build these systems, we actually have to develop systems that really can relate to the people, to the person, to the family that really have to put food on the table and have to buy drinking water.
Okay.
Thank you.
Mr. Michael, you are involved as an entrepreneur in focusing on empowering the communities with access to safe water. What is the biggest challenge you're facing as an entrepreneur, and what would you wish from the people to support you with, so that the role of the citizens also comes out in this particular conversation? Your mic is on, just try it. There.
Yeah, thank you very much. Yeah, thank you very much, Trevor.
Yeah.
And good morning to everyone. I'll just skim through a bit of points that I'd come up with before I come to the challenges that we are facing. Firstly, is the role that we play as a corporate entity, as a commercial entity that we are running, to provide the community and the individuals around Mlolongo area with, first of all, clean and safe water for general purpose use. So what we do is, of course, we have the testing from KEBS and the Water Institute every 3 months to ensure that quality happens. That's why we have clients on our portfolio like Daystar University, Victoria Juice, Golden Africa, who make the golden kind of oils. So that's why we have such customers. And then over and above that, we have strong partnership with people like Davies and Shatcliffe, who provide chlorination, automated chlorination for the water that we distribute through the piping and our bowsers. Secondly, and what also had been said by the panel before us, is that caters, the first point caters for the water quality. The second point is we need reliability, because these households, if you're the one who's providing over 200 households with water, then all of a sudden you do not have water. That causes a lot of disturbance in terms of the place. So how we've done that, our biggest input is electricity, all right? And sometimes Kenya Power might fail. So what we have, again, is a strong partnership financed by Family Bank, who have invited me here to this place and given us a very strong generator which does a 3-phase pumping for that. So last and finally, you must make it affordable for the people to use it, all right? So this affordability comes from cutting costs of production. So we're in the final stages, in fact, of giving a proposal to our financiers, Family Bank, to give a solar energy solution, which will now reduce our major costs, which is electricity, and that subsequently will go to the customer. So those are the things that we are doing as a corporate entity and a business entity running within the Mlolongo area. Just to mention, I think ultimately, there's so much which is being said, but ultimately, for a reliable, sustainable source of water, I think we must go the way Mr. Mwangi Githaiga was saying. We must tap water and the rainwater and see how we can distribute to the households.
Okay.
So
All right.
thank you very much for that.
Teacher Tabichi, I'll come to you on this, and you're a science teacher. How do we leverage on science, and how do we ensure that information is passed to the future generation so that we have access to clean water and ensure that they know that they all play a role?
Thank you so much for this chance. First of all, it is a great privilege to be where I am, so I thank everyone, and especially to be a champion of the hand washing program through the Dettol program. And you know that, yes, I'm a teacher, I work in education, but here comes, this is on healthy, on about water. And you are all aware that all the SDGs are interlinked. And therefore you cannot just say that, let us just deal with this, and then we don't talk about the other one. So that's why I'm here. We work as a team, we cooperate. And to me, I think it's about changing the mindset, as many people have said here, changing the mindset. And this can be done by building a new culture in our people. And we start with the young people. I like what some have said, that we start with the young people. And the young people here, we talk about the children in my school. And I'm so happy with the competence-based curriculum. I wish that it integrates these practices about the hand washing, the wood hygiene, the importance of this. We show them and we teach them on how, for them to embrace that. So I feel that that's where it should start. And as a science teacher, I believe that science and technology can also enable us to move forward. And right now, I have a group of students who are doing something around water, and they want to come up with a project of purifying water. So this means that we need to be creative. All of us, we were, human beings, that's why we are different from other creatures. We need to use our creativity, and then I'm very sure we'll be able to come up with many ways, better ways of ensuring that we have access, we have clean water. And then the other thing is, like in my area, it's a rural area, and the students come from very humble backgrounds. And when I visit their homes, I normally just sympathize what they go through. Some of them don't have water. So I think one of the things that can be done is think of ways on how the water can be stored, because stored is water storage. Because at times we have rain, but now the problem is, how do we store this water? How do we make use of this? How do we water correction? So that's what can also be done. And then also, how do we minimize water wastage? Because at times you find that there's plenty of water, but there's a lot of wastage. So we have to also think about something around that. And then the other thing is about collaboration. Like right now, because where I come from, that village, there are quite a number of challenges ranging from poverty to, climate, all of that, like just other places. So as an individual, at an individual level, I came up with a project of drilling a power. Right now, it's the group came on Monday. They started doing the drilling, but I liked the way the school supported, the way the local leaders came in to support. Everyone supported in one way or the other. So I like that kind of collaboration, and therefore, for us to move forward, we need to work as a team, and therefore, that's why I think it's very important that we need the support of each and everyone, even the community. Like now, I saw so many people coming there to see how that borehole is being drilled, and they were asking, are we also going to benefit? Yes, I know it's going to benefit the students. Right now we have the COVID-19 pandemic, and it's going to support the sanitation and the hand washing program. But then we'll also think of ways on how it's also going to help the community. Maybe we give them, we sell to them at a very low prices as compared to other places. So maybe that's how the community will also come in. And then I also want to appreciate what the Dettol has done. So right now it has, in our school, it has built for us toilets. So the students are very happy, that they have enough washrooms, and it's really going to help. So back to my area, science, I really emphasize the fact that we need to use our creativity and change our mindset. Once we change our mindset, I'm very sure we are going to achieve a lot. Thank you.
All right. Thank you so much. Dr. James, there's other issues that are also coming up, and Teacher Tabichi has actually raised one of them. We are now dealing with climate change, population growth, but also we want them to have access to clean water. So how then do we readjust with the changing times, keeping in mind that we haven't even achieved it in the previous time that everything was okay? Now we're dealing with a whole new scenario. There's climate change coming through population growth. How do we leverage on that and ensure that we are changing with the times and people have access to clean water?
What I've seen in practice is we need to embrace the situation as it is. You know, if, once again, using the example of an elephant, if you find a dead elephant in your river, you could mourn for it and pray for it and, complain about it until the cows come home, but that elephant is dead. So climate change is here with us. The question we should be asking ourselves is, how do we future-proof our communities? In fact, the conversation we're having today is a very important one because, for example, from a government perspective, anyone who is polluting rivers is an enemy of development. It becomes, government policy should be, going forward, we are not willing to play hard and loose with anything that affects our environment. That's one. But then number two, we then need to, the message to our communities needs to be, let's take care of environments. Because growing up, I grew up in the Moi era, and Moi was big on planting trees. But that seems to have, we've forgotten about it. We don't talk about planting trees anymore. But if we go back to, how can we, or even gabions, lots of people must have thought it was a stupid thing, but soil erosion is part of the reason why you have the Rift Valley lakes being full of water now. So how are we able to engage with our communities for them to understand that they themselves taking care of their environment also ensures that their water supplies are safe? Because if people are in forests because they are poor, but then subsequently in 10 years, there are no forests and there are no rivers, it's a lose-lose situation. But then the second one is this, that how do we also embrace early adopters of whatever technology it is that we are pushing? For example, there was talk about tanks, that the people who buy these tanks as the first line, we use them to then become ambassadors in the community, that they are able to discuss with the community and tell the community that since I planted, let's say, trees in my garden or I find that my children are healthier, the environment is better. So we need to use the community to be the one that is engaging with everyone else in the community. Yeah.
All right. And I mentioned this is going to be a 360 conversation, so I'll bring back the microphones to you guys as well so that you chime in on this, because now it's the role of the community in ensuring we create future-ready communities to save lives. And Mr. Mwangi Githaiga, I know you were with us in the first panel, but I'd like to leverage on your experience just to find out how can we then have microfinance to fund certain universal access to water, for example? Why is it that, yes, drilling boreholes is a business, there are people who are drilling it as a business, but why is the government not able to just even drill boreholes in places, and we have wards now through the MCAs, and ensure that people have access to clean water? Why does it have to be a venture where people have to cough out money? Like Teacher Tabichi is now paying for the borehole that is being done unless he has partners. Why is it so difficult for us to just get government to do that for free in all the wards?
Thank you very much, Trevor. But okay, but I come from a different school of thought that the best solutions are community-based solutions, because the government cannot be a solution for every problem that we have, because government has limited resources. In fact, my take is that government should create an enabling environment so that private sector can invest in areas that make economic sense. And that's my take for it. And as a society,
we need to take responsibility of our own environment. I'll tell you something, Trevor. Poverty has no dignity. Poverty has no dignity. When one is poor, everything is lost. If I don't have food, you cannot talk about quality of food. If I don't have access to water, you can't tell me about quality of water. The first thing you need to do is to create access. And the best solution is to have community-based solution. Once we do that, then the rest of it will start rolling itself out. And we need to stop this thinking that the society doesn't know. In fact, in microfinance, what we say, go to the people, live with them, understand their needs, and create solutions for them with them. Don't go from Nairobi with solutions. So we can do boreholes, but how many boreholes can we do? How much water goes to the river, to the Indian Ocean? We don't need boreholes. Boreholes are good, but that's not the primary solution. The primary solution is harvest water at your household level. Store it, make it clean, create solutions for making water clean without inputting too much energy. So I think there are solutions, and that's where, and like Tari says, most of these solutions are very simplistic. I think we overcomplicate issues, and that's where microfinance comes in.
All right. Let's see if you have any other hands up on this issue of how do we ensure that the communities have access to clean water, and what is our role really as a people? What can we do differently? Is there a hand up over there? Yes.
Good morning. I'm Elizabeth Were, a change management consultant. I do work with both the private and the public sector, including NGOs. So I'm for the school of thought that, yes, the government has to create an enabling government, and at the same time, there'll never be enough subsidies to go around. I think that's really key. However, from operations perspective, is how much are we doing with what we already have? If we look at some of the challenges that are being mentioned today, so what the lady talked about, toilets not being used or programs that are not really practical at the community level, it means we need to look at our approaches, but also need to look at how efficient we are running. Are we able to deliver more with what we're already getting? Or are we constantly waiting for the government or the donors to give in more money? I think the situation has changed quite a lot. So what can we do as professionals?
All right. Thank you so much. Is there any other remarks? Raise your hand if you have. Yes, over there, the farthest end.
Okay, good morning. My name is Dennis. I'm the WASH SME officer at Family Bank. And my clarion call will be, let us see people invest more or partner more with financial institutions. Give us guarantee funds so that we can be able to subsidize our interest rates for online lending to the community, because it will push us to lend to the micro people or to the people at the lower cadre. But again, we view this as the high-risk customers when it comes, because definitely they won't have collaterals. So our cry to you or our request to you, mostly the donor funds or the development partners, give us guarantee funds, and as banks, we'll be in a position to lower our interest, and at the end of the day, the people at the lower level, they'll be able to have access to cheap financing in the WASH sector. Thank you.
All right, thank you so much. And that's an important aspect. I see there's another comment here, and Victor, I'll come to you to talk about that issue of financing and how those products should look like for people on the ground so that you're able to afford it at the lowest household level. Let's take that comment then, and also come to social media there and also speak to the people on Zoom or joining in on Zoom, their comments and their questions as well. Go ahead.
Thank you. Mine is just a comment. I would say that with this evidence that private sector can play a role, at Water.org, we have partnered with microfinance institutions in Kenya since 2011. I've been able to disburse over 850,000 micro loans over the last 8 years, reaching around 3.9 million people. That's a big number given that the gap we have. We've been able to close it by 3.9 million. And of course, bring in capital in terms of investments worth 40 billion in the sector. So this is a good example of private sector playing a role to try to address the gap we have in terms of access to water and sanitation in the country.
All right. Victor, there's a question coming through here on how then do we empower the individuals to take up their roles in achieving the future-ready communities. One of the issues that has been brought up is financing. But how should those products look like so that the lowest of households can first access and afford, even if you advance the money to them?
Thank you, Trevor. I think even before we talk about finances, the skill that goes into managing the finances in the first place. So I work with a group of ladies right now who want to get in various businesses. And you realize because they've had certain banks giving out loans, so they want to go and get the loans. But in real sense, if you ask them, how do you save? How do you do all these things? They don't even know. So differentiating between their own personal savings and the business savings is difficult. So I think the first thing that probably the microfinance institutions and financing should actually be able to do is figure out if this demographic, are they able to manage the money that you're giving them? Otherwise, you're going to give them money, 1 year down the line, you don't have the product, your money is gone, okay? So you come with Shylocks and you pick all these things. So that is the first thing that I'd like to encourage you guys to do. The other thing is, how much money do you give these people, okay? So yes, this is the cap and this is what we can be able to afford. But in real sense, is that what you have decided or that's what you have decided with them, okay? Depending on their sources of income and everything else that they are doing, are they able to pay you the money within the stipulated period that you have? So those are the things that we need to look at. And consistently empowering them in the process. That is something that you actually need to look at. Give money and then after 6 months you start asking them to pay you back, it's not going to help us a lot. It's not going to help us very much. So how do you consistently ensure that with these households, with these entrepreneurs that you're working with, you ensure that there is something else that goes beyond the money, the skills that are required? How do they monitor if their business is doing well or no? How do they even make profits? How do they do all these things? So I think just before we give them the money and say, yes, the money take, there's a lot of work that has to be done. And that is why a lot of guys, a lot of microfinance institutions, you approach organizations, you approach individuals and all this. They will come because they've seen the money is good. But then again, the process that will go into you getting the money back, it's going to be a long and lengthy process because we did not start where we should actually be starting in the first place.
Okay. Mutuku, I like to make the conversations practical the same way we are doing right now. So if I came to you today and told you there's a village in Turkana, I need you to get maybe 20,000 liters of water there. As an entrepreneur, what is your first concern when I tell you that? They're a village, they need access to water, you have water, get it to them. What would be your biggest challenge and why would you not want to do it?
Well, first of all, you'd want to know where you're sourcing this water.
Raise the microphone a bit. Yeah.
First of all, you'd want to know where you're sourcing this water, because the best business sense would be the closest place. You source the water, then you take it there. Then again, you'd want to know, are there roads to this place, all right, to take this water there, all right? And if me going there, what business opportunity am I leaving behind? Because I'm going to travel for 5 days to get there, to take water worth even 50,000, all right? But every day, probably that's the amount that you make from your water bowser. So it doesn't make a business sense at all. So that's why I'm saying at a community level, it's different from the urban. From the urban development area, I mean, the government must actually look to provide water into houses in Moja, Buruburu, different places like that. Yeah. That must be done. But at those inland, like communities, like where I come from, I would rather you do an earth dam, all right? I don't need tap water in my place, all right? Just a close proximity, I can draw water for use, and then I can pump maybe for some vegetables that I want to. So it makes sense, because if you drill boreholes, I mean, the investment that we've been given by Family Bank is well over 20 million, all right? That's one borehole because there's a generator, all these things, to provide reliability. An earth dam that is a sizable one. With 2 million shillings, you can do a serious dam, and you get, the rains are coming. You'll get a lot of water, will sustain you until the next rain. So that is what is sustainable for the communities out there, not boreholes and things like that.
All right.
Thank you.
Teacher Tabichi, I'll come to you in just a bit to tell us whether the students can relate the issues of environment vis-a-vis having access to clean water, and whether the 360 angle can be seen by the students in terms of science. But I want to bring back Francis Musinguzi here, the Africa Regional Director, water.org, to talk about the technical aspect of population growth. Is it going to be a challenge going forward, or is it that people are moving in a place where there's not enough infrastructure or development, and that therein is where the problem is? Is it possible that we are being overwhelmed by the population growth, or are they all heading in the same place? Therefore, they're like 2 million people, but they're all in the same place, rather than spreading them across, and therefore infrastructure would support them.
Thank you. Thank you very much, Trevor. And indeed, like where I started, is that what kind of narrative we are looking at. The question is not the population in terms of numbers, but the quality of the population. The 1.216 billion people in Africa are seen as a problem, are seen as a challenge. But here we are saying we need to turn that narrative right side up to understand that as this population grows, the solutions we are speaking about are simple solutions that can be supported by the people at what we call the bottom of the pyramid. And therefore, our solutions should be focused to the level where these people are. Otherwise, if we keep the current way of thinking, I am trained as a water engineer, and I have been in drilling boreholes for over 20 years. I realized that solution is not sustainable. Why? Because it assumes that the 1.216 billion people are not able to come up with solutions. And that's why you see whenever we would come to drill a borehole, as a young engineer, we would put a red tape around, and communities would come excited to see what is being done somewhere over there. And then when you finish and complete, you launch it, then the community receives it. But statistics show that 88% of boreholes which are drilled in Africa don't live to their first birthday. This is a bigger elephant in the room. We know this cannot work. Therefore, population growth is not a challenge. The question is, can we make sure the solutions we are coming up with are able to be sustained by that population that is growing? Yeah. Can we make sure that our empowerment doesn't look at the infrastructure, but rather empowers the people, those women, those girls, those young people out there, so that they are able to come up with solutions that they can sustain on their own?
That is fascinating. 88% of boreholes don't even reach their first birthday, and yet that is the rallying call for most politicians. Do we know why?
Yes, I do. Of course, we've done many studies on that. Yeah. That could take us so long. But the bigger statement is, you have drilled the borehole out there with a red tape. None of the community members know what you're doing. What is in a borehole? There's groundwater. There are all those pipes. No one knows where they're coming from. This groundwater has arsenic values that are eating up the pipes. There is maintenance costs you're not telling anyone about, including the county governments and the national governments. So there is so much about financing that big elephant you're thinking in there. Instead, we should be discussing this infrastructure and ask ourselves, can this population be able to sustain such innovations and technologies we are throwing in there before we start? So the question of, are they sustainable? Are they affordable? Are they appropriate? This is where the big challenge is coming out from.
Oh, wow. Thank you so much. All right, let's see any other remarks. Let's see. Yes, Dr. is over there. Thank you, Mr. Mwangi. Yeah, it's on.
It's on. I wanted to add my voice on what has been said, that, you know, the problem is sometimes we kill a fly with a sledgehammer. You see, boreholes, like has been said, we know it's not the solution. But the other thing is that we need to notice is that water is a scarce resource, and the populations are growing. So I think the first thing that we need to do as a country is to protect our water bodies. And then we conserve the water. We make sure that we protect as much water as possible from the source by creating strategic water reserves that can flow slowly to the society. And I think if we do that, then as a country, we will be in the right direction. Boreholes are not a solution to our water problem. problem in this country, especially at the community-based level.
All right, thank you so much. Let's see if there is there any other remarks on this issue. Yes, over there. We'll come to you, and then Teacher Tabichi will come to you on the issue of conservation and how to include the students and the younger population. Go ahead, sir.
I want to comment on what the panel was talking about in terms of that financing in itself is not complete on its own, and there is need for financial literacy. And that is what we need beyond giving the customers money. And I will talk about even KWFT, that one of the things that we do is to ensure that we actually train our customers on financial literacy. As we talk about even the wash product, we are not even talking, I look at our wash product, and the average loan size is actually 50,000. So you look at that, and that is quite affordable. And that can enable the customers to ensure that they store water. The other thing that we need to look at, we look at the community health workers in the village wherever we are. We have structures on the ground because we have chamas, we have CBOs. We can bring those people together. They don't have to borrow for them to access water storage facilities. They can as well save, and they can be, the infrastructure or the CBO can organize with the community health worker on how the communities can get the water storage facilities. Thank you.
All right, thank you so much. Did we see any other remarks here? Or questions, comments, remarks? Just raise your hand and we'll get the microphone to you. There's a question or a comment over here. Yeah.
Thank you very much. Just to also add on what colleagues have raised, I think it's important when you are doing your financial
planning. I will So after 1 year, it's over. So we really need to focus on empowerment, especially when it comes to financing.
Yeah. All right, you're allowed to ask any questions and make comments as well. If there are any questions for the panelists, just raise your hand. We'll get the microphone to you, and then we'll go to the people tuning in online also to find out what they're saying there in just a bit. But Teacher Tabichi, the question here now is, what more should be done to teach the younger generation to relate the issues of conservation to the water that they have eventually? Because there seems to be a bit of a disconnect there. When you tell people to plant trees, they're wondering why. When you tell them to conserve the water, they're wondering, why should I bother? I mean, if I clean my clothes, all I need to do is just dispose the water. Simple. They don't understand that they could use that also in their washrooms and flush down. Conservation, how then do we instill that in the younger population so that it spreads to the village as well?
Okay, thank you. Education is not all about academic success. And that's why I'm so happy that we have a curriculum that is really supporting that holistic education. And in that regard, I believe that we should start making our young people, to embrace some of these practices, and especially showing them, how if it's about tree planting, how is it done practically, and it should come back to, it should be part of the lesson. Like whenever I teach, even if it's a maths class or a physics class, I try to bring in those practical aspects. And then the issue about the climate change, if I'm talking about the green, the greenhouse effect, I try to, make it practical, and then they see it. So they are able to appreciate, but other than just looking at education as just only about theory, giving them only just things, just like provoking their minds. So it's good to really make it very practical, and then making that learning enjoyable, and showing them how this is done, how the tree planting, how to conserve the environment practically. And that's why I engage them in a number of club activities. Like now we have the Peace Club, and they are able to do some of these things, and they appreciate. So when they go home, you see them even doing that with their parents because they appreciate it. They know they are not doing this because they are going to pass exams. They know it's something that is going to help them in their future. And then the other thing is also to demonstrate to them, like if we are parents or teachers, we do it. We don't just talk and then we step, backwards, so we don't do it. So we have to demonstrate to them, and then they now be able to see that it's important for us to do it, because our leaders, our parents, or our teachers are doing it. So I think that's what we also need to do.
All right. Dr. James, I'm wondering, and I mentioned that we like practical approaches. So I'm sitting at home. I am a parent. I have children. How should then my budget look like, or where should my focus be, considering you've just mentioned that most bankruptcy comes out of diseases that can sometimes be avoided by simply maintaining hygiene levels? Keeping this in mind, and it is not something we are taught from childhood, if I'm a parent sitting at home with my children, where should my focus be? So my budget is in here. I'm thinking rent, I'm thinking education, I'm thinking school fees, I'm thinking food. Should I focus on sanitation? And what should that look like?
It's an interesting thing you should say, because in my household, the biggest driver of hand washing is my wife. I think she has a sixth sense for anyone going to the toilet. If you go to the toilet, as soon as you're out, even myself, even if it's at 3 a.m., she'll ask me, have you washed your hands? So what Bonagidaiga said is actually very true. When you make it look like it's a very big and difficult thing, globally, we have countries with nuclear weapons, we have been able to send men to the moon, we have been able to go to Mars. But against coronavirus, what do we have? 3 things. 3 things. Wash your hands, wear a mask, na ukae na kiherehere yako huko, keep your distance. So actually the solutions are very simple, and they are not expensive, because I believe every household in Kenya can afford a bar of soap. It's like Mr. Githaiga said, you have a shop around the corner, you can access some water. Forget even about sanitizers and whatnot. Maybe we might not be able to afford that. Can we instill in our children from the get-go, from the word go, wash your hands every time you go to the toilet? Wash your hands every time you come into a house. Ukiingia kwa nyumba, you've come from school, you've come from work, wash your hands. Wash your hands every time you are leaving a house. If you're about to eat, wash your hands. The more times we repeat this simple message, the more it becomes a habit. Once it becomes a habit, now the rest will follow. The second thing is this, that we ourselves as adults, are we preaching wine and drinking water, or are we drinking water and preaching wine? What do our children see? Because let's say, for example, we want our children to be physically active, or we want them to read books, but you're sitting watching TV while they are reading. You're sitting watching TV and you're telling them to go outside and play. We need to be the role models for our children. Our children should grow up wanting to be like us. So, and why is the expense in that? That has no financial implication. To be a role model to your child just means that you do the things that you want them to do. They say, if you want something to be done in your house, you have 2 options. Either you do it yourself, or you tell your children not to do it. But there's a third option, show your children how to do it.
Okay. Victor, are we simply using economic pressure as a scapegoat? Because we gave the example, and I'm the one who started that example of someone in Kibera who earns 50 shillings, she has 4 children. Will she focus on buying food or water for drinking or water for cleaning? But somehow, she can manage to buy all. Are we just using the economic and financial constraints as a scapegoat? Because people still do live in the city. They are able to pay their rent. It's just that maybe it's the water, access to water, that they are not prioritizing.
I think he must say that poverty is very, there's lack of dignity with that. And when you tell people, when you still it in their minds that you are poor, it is definitely going to stick that you are poor, you can't afford it. So how then do we ensure that even as we approach these communities, we tell them that there are things that you can be able to do? Because if we get into that mindset and telling them, you just earn this, therefore you cannot do X, Y, Z, then it will definitely go in their minds. Think of the things that people have told you that hurt you. It really remains, okay? So what do I think we should do? First, I think our messaging should be around empowering the communities. When you empower them, they can be able to prioritize these things that you're looking at. They can be able to say, out of that 100 shillings that I'm earning, I need to put bar of soap as a priority. I need to put XYZ as a priority. And that will really depend on how we approach the whole system. The other thing is, even before the household bit, there are already existing systems in the community. And we are talking about community healthcare workers. You know, this is the first people that the families actually run to when they have a health problem. This is the first contact person that they'll actually reach out to. So how do we ensure that in our absence, as donors, as development pastors, as government and all this, the community healthcare workers are able to consistently empower the communities? Because this is their community. This is where they live. Some of these community healthcare workers literally know every single person in a household, their names, where they go to school, whatever that's bothering them at that moment, they can be able to tell us, okay? So I think even at that time is, how do you ensure that the community healthcare workers are able to support the families so that we don't use economic situation as a scapegoat of saying, oh, you need this, you need this, you need this. We are constantly looking at what they do not have versus what is it that they can actually bring on the table, all right? So those are the things that I think we can be able to do to support the families, the communities, to basically get access to clean water and sanitation.
Mutuku, and let's stay with the role of the communities for a bit. I know you are involved in distribution of water through pipes, connections, and water bowsers as well to different locations. Have you encountered a situation where you feel like the community are shooting themselves in the foot? You have the pipes there, they vandalize them. You have the pipes there, someone who is known to be the person who distributes water in that area disconnects it so that you still have to come through them to get the water to the people in the village. And yet the people themselves already know who's propagating all those issues to them, and they just don't bring it up.
Thank you, Trevor. These are the challenges that we face, because we are operating in an informal settlement, by and large. Mlolongo is informal settlement as it is. So piped water, there's a lot of illegal connections, all right? So that means there's revenue loss. Again, raising the Kenya Power bill, becoming difficult to pay. But all this, we have tried to incorporate technology. The company called Bridge Analytics, which does analysis of our month-to-month billing and because every other day we do readings of all our meters, around 350 of them. So they do analysis, and where there's a deviation of 25%, either plus or minus, then it raises a red flag, and our plumbers immediately, the manager just says, look at these meters, what is happening? There is water loss between here and here. So it is captured almost as immediately as it happens. Yeah. So securing, of course, revenue and making the business possible to happen. Yeah.
Teacher Tabichi, I'd like you to start closing remarks on this in terms of solutions. So where do we go from here? You mentioned that we train the younger people so that they are more conscious of conservation, but what else do we do even on the ground as a people? Dr. Mutuku, Dr. Gaduki said that, you know, you have to start by leading by example yourself. So what are the solutions going forward? Where do we go to ensure that the communities understand that it's for their own good, really, to ensure that they have access to clean water?
Thank you. I believe that you have to work with people, not for people. That's why at the beginning I also said that there's need for collaboration. Otherwise, if we just take this to them, like now I was talking about the borehole. Okay, anyway, I was not to have the borehole. It's only that I was in a position, there was so much like support, and then I saw, let me do this. And then it was like, to me it was like a privilege, and then, so that's why. But I've really seen quite a support of many people, from the school administration, local leaders, and it's like everyone has participated in one or the other. Like now, we didn't have a 3-phase. We only had a single phase. We could not be able to do any kind of, this heavy, whatever that requires high power. But right now, we have a 3-phase, and that was through some, teamwork. And that was like, within a very short time, we had electricity. And then the school was able to facilitate, you have to get the NEMA, you have to get some some permits. So it's like everyone came in. And therefore, I'm very sure they are going to appreciate now that it's a kind of a teamwork. Yeah. And from here, I believe that we need to really focus on ensuring that our young people have a changed kind of mindset. They have the values. It's not just about giving them the only the knowledge. Yeah. We look for ways on how to ensure that we get them also to appreciate the fact that there is an animal called climate change and its impact. We need them to appreciate the importance of these others. We have the creativity. How do we make them creative? We don't tell them just be creative, but you engage them in activities, and then after they have done some group work, you see that kind of creativity coming in. So I believe that's what can be done. And then finally, what can also be done at the local level, as many people have said, there is a need for some kind of financing, because like in the village, at times there's rain and there's water, but right now they don't have ways of storing the water. If we get some ways of supporting them, for them to be able to store the water, and I'm very sure that's really going to help a lot.
All right.
Yeah.
Okay, Mutuku, closing remarks on this, and then I'll come for closing remarks from the audience as well on this conversation. Go ahead.
Thank you very much, Trevor. So just before closing remarks, I just wanted to highlight a small bit on the financing of these projects. We have been part of them, all right, where we take maybe people in Malili, Athi River, Kajiado, Kitengela, and actually just at individual level, engage them. We buy a tank, put it up, and then tell them you can sell water here, you're going to give us this when we bring, and then you can repay this tank at this rate. So I think the microfinance institutions can actually get these self-help groups within the community and actually engage them, because water is life, yes, but has provided livelihood for me, my family, and of course the people who work within the area. So it is a great opportunity to invest as a financial institution for people to get some economic value out of it. That said, I would like just to finish with, I think there's someone who said that we are not talking about leadership so much, about when we say how to provide water for the whole community, not only Nairobi, but outside Nairobi. Yeah. I think we should talk about leadership and its commitment to the policies that even they agree upon, right? So, I mean, you can talk about all these things, but you cannot run away from that. Some dams were not done the previous financial year, big money. So we are not scapegoating money, that it's an issue, but that money should have done dams for a certain group of people, and they would have been enjoying the benefits of water. Right. So thank you very much for having me on this panel. I appreciate Family Bank for giving us the support and working with us. So asante sana.
Thank you so much. Victor, closing remarks on this?
My closing remark will be, first of all, to challenge us, the people in this room. And the challenge is, you have all this information. How are you using this information? Take this information to the people who really need to get it. Challenge the government, challenge yourselves. You know that boreholes do not work. I mean, if someone comes and say, we need a loan to build a borehole, why do you give them the money in the first place? Okay? So for me, that is the first of all, the challenge that I would like us to take home. The other thing is data and information. Dr. You've done it for 20 years. You have a lot of experience. Someone is just starting, okay? How are you able to share data and information for us to be able to make informed decisions with the experiences that we have? How do we open the channels that if I want to start a water station in my community, I can be able to access the information that you have that will help me in one way or another to basically know what I'm getting myself into, all right? I think the last thing is start. And, you know, how do we wash our hands, as my brother said, is go to those schools and challenge the students to take these practices back to their families. Right. Because when they actually do that, they can be able to change the whole family. Okay. So please go and, you know, do something with the information that you already have.
All right.
Thank you.
Thank you so much. Dr. Gadhuki, very brief closing remarks.
Mine is to say that we are all on the same side. And because of that, we need to think of ourselves as team players. What can we do? What role can we play to ensure that we are moving this WASH agenda forward? Because, for example, what he's saying is actually true. The one organization with the most experience in terms of water and sanitation in this country is the government. They're the ones that have been providing water for half a century. So if Mr. Mutuku starts a facility today to provide water, but he's providing with water without chlorination, it's not his fault. It's the government's fault. Because every time the government gives, let's say, a license for you to drill a borehole, then the due diligence from the government is not necessarily to provide with funding, but it is to tell you these are the bottlenecks, these are the problems that we've seen in the provision of water before. So while the government might not need to provide funding, that key role it plays in terms of the government is busy siloing information and knowledge that it has. It shouldn't look at Mr. Mutuku as a competitor, because I'm assuming there's a Machakos water and sewerage company, right? You're not a competitor. You are an add-on. So, in fact, Machakos water and sewerage company should be your greatest supporter, that they tell you, actually, there's an opportunity here for you to provide water. We will give you maybe like space or whatever it is. Because if we do it like that, if all of us think of ourselves as team players, that when the government sees someone wanting to start, let's say, for example, water.org, you're looking at doing microfinancing for people to pick up, the government should now get you in touch with the Rototank. That Rototank, the government does that liaison service. It doesn't need to provide any funding. Or, for example, what your best practice is, the government picks that up. And when there is an organization in Turkana that wants to do water, they can leverage their knowledge of best practice elsewhere, even from microfinance companies. The government should be saying, look, KWFT has done this for the last 25 years, so what you're doing is not going to work because we've seen it tried and failed before. So if all of us are playing that role as team players, I think we will go far.
All right. Thank you so much. A round of applause for my panelists. Asanteni sana, Dr. James Gadhuki, Victor Odhiambo, Michael Mutuku, and Teacher Tabichi. It will not be fair for us to close this panel discussion without the people who are tuning in online to hear what they are thinking back there. So we'll just take the microphone to them and then read some of the comments on Zoom and on Facebook, on Instagram as well, hear what their thoughts are, if they have any questions. Before Chipukizi tells us what his experience has been like coming from a region that is well known not to have water.
Morning.
Morning.
We have questions from Facebook. Victor Muturi says, interesting discussion about water requirements. However, can the technology such as filtration systems, industrial filtration systems be used, and can they be subsidized by the government? Tom Mutua, also from Facebook, says, being in the water business or purified drinking water,
I'm much worried about the newly introduced excise tax, making it hard for both us, the producers and consumers. What can be done? We also have comments. Halima Isa from Facebook says, teach us, the community, how to harvest, to conserve, to treat, and to maintain water. Akelo Onunga also says, water will become a future crisis that Kenya can avoid. As individuals, do we have a duty to ensure our own water rights? And Dora Musinguzi says, thank you, Francis Musinguzi. Borehole drilling and other aid-driven initiatives are very strategic programming options, following with interest from Uganda.
All right. All right, thank you so much. I think the issue of industrial filtration can only be answered by the engineer, Francis. Yeah, I think you're the one who would help us with that. And then there's the issue of excise tax that they've been talking about. Yes.
Thank you so much, Trevor. I would like to approach that question from the fact that much as we're looking at subsidization and technology, but we need to rather consider this as a market. That the government shouldn't disrupt the market, but actually should make the market work. And how to make the market work is what I think already the panelists have been discussing, that the government has a role as a policy maker and a regulator. Make sure you have a regulation mechanism that is fair to all. Okay. Any entrant is not a competitor, but all these add value to the process of providing water and sanitation. And then lastly, all the public financing must be equitably utilized. Accountability is at the heart, and to make sure that where we have partners that are playing a clear role, Kenya Women Microfinance Bank, the government can give guarantees to make sure they can get on their feet. Where we have utilities that are struggling, the government can give a guarantee to make sure these utilities can pick up pace. All over Africa, utilities lose 40% of the water. Imagine you had a business and you're losing 40% capital. Let's rise up. There is a big challenge in the room. This elephant is how do we make sure these utilities run as businesses. And in fact, the private utilities that are coming up provide good lessons and good knowledge for sharing for the bigger utilities we have known to succeed and make sure everybody has access. Thank you.
All right. Mr. Mwangi, maybe the question on excise duty that is currently burdening the people providing water.
Thank you. Thank you very much. I think that was my statement there, that if we want something done, then we must put our money where our mouth is. If we think water is important in this country, then the question that was raised is we must deal with it. But having said that, I can also add another issue, because I know we talked a little bit too much about boreholes and a little bit almost too, they are not good. Boreholes are good, but you have to have a business case for it. Okay. Don't just drill a borehole as a social project if it doesn't have a business case. If you have a business case, you will be able to maintain the borehole. And that's where we go wrong. We go to the community, drill a borehole, don't tell them how they will be paying the electricity bill. After 1 month, 2 months, the thing is discarded. Okay. Those are the issues. There are very simple systems of water purification that are so simplistic, they don't require energy. We have a unit that we finance. Okay. It's about 7,000 shillings, purifies water, removes the bacteria, simple, no boiling water, easy, household. Okay. You just have to do it yourself. Right. So I think we need practical solutions for our problems.
All right. Thank you so much. That winds up our conversation. I'd like to allow my panelists to get back to their seats in the audience section. Thank you so much for that. A round of applause for them as we get the podium back up here, so that there's going to be a brief announcement by Mr. Ibrahim Kabir, the Detol Water Fund announcement that's coming up with the country manager, RB Health Kenya. As that happens, Chipukizi, you wanted to tell us how you survived before you call upon the country managing director. Yes.
First of all, clap for yourselves, guys. Jipigieni makofi sana, sana, sana. No, come on, you can do better. Jipigieni makofi. Like people who are having a very powerful conversation. I think mine, I just want to say, I am a testimony of what you guys have been doing and what you're discussing, because I became popular because I started cracking jokes about the place I come from. and I come from Mlolongo. Kasai umetusaidia sana tafadhali. And the joke was, kwetu hakuna maji. That was it. That's it. And now, seeing you guys talk about it, I can understand everything you're saying. It's true. The only thing that the government and financial institutions don't have is the people, and the people need them. However, when you come, because I used to go to school, nikikanyaga maji on top of water, and yet we don't have water in the evening. You get? So, you look at it and you say, if only what you guys are saying now, if only it can be actualized. I'm telling you, the problem of water in our country will be long gone. And it's a big, you see, if you do like the projects you're saying, if they're done and you involved young people, the community, even in the process of digging it, instead of going and damming, we want to construct a borehole, instead of just taking it there like they've said and going, or you're bringing other people who are not from that village, you're doing zero work. Because also, again, back to that testimony point, I came to Nairobi because Gilo came to my village to dig a borehole. And when he involved us, we sat down, we talked, and from the money that we were paid, we were able to come here. And look at me. Now I've gone back to the same village, and as a matter of fact, I am doing the same thing you guys are saying. I went to Malili, he knows, a place where, I met with women, just mothers. And they were saying they've lacked one person who can reconstruct a dam that was done many years ago, like before independence. And they were telling me, if we can get an angel who will come and, just touch this dam, this whole village, that whole Malili area, you'd have given all these people water. And then I said, I am a celebrity, where do I start? Do I go to government? Do I go to Mutua? Where do I go? Do I go to get a loan? But I can see the problem, and I can see the people. And then I said, have 10,000, let's start digging it. And then me and the people now, we're actually digging a dam together with friends, just Kamba boys. And the only thing we are lacking is that government support, is that, financial institution support. You understand? So it's actually what we are discussing here, because I'm so passionate about water. Let us make sure what you've said here, we follow up, we try and see how we can be, we can put all those ideas together, because people are dying and we need this help. And thank you so much. And once again, jipigieni makofi sana, makofi mingi sana. Asante sana mwalimu for coming and everyone. And we have an announcement here that I want to call our country manager to come and make, but also him, because he's our country manager. Tumtengenezea zile makofi za Moi. Zile za Moi. Mnazikumbuka zile za Moi? Haya, viringa kidogo, Haya, moja. Karibu, our country director, utupashe, fungua. Asante sana. Asante sana, karibu sana. Let me sanitize. Now, this is how people get fired. Let me give you, I need a sanitizer, please. I'm sorry, my boss. Let me sort you.
With actually the panelists, all the members of the panelists that were able actually to grace the invitation today. And I can just assure you that all the conversation actually we've had here were super powerful, and they're very critical, looking actually the situation we are currently having in pandemic. And if you look at it, maybe some people could be just wondering what is happening. We are celebrating Global Hand Wash today, And what are we talking about actually? About water access, water access. But we all know that that is, the foundational element of which generally the hygiene starts from. So without proper water access, whatever, hygiene practice actually you want to drive, you want to encourage, you want to motivate, cannot just happen. It will just be a mirage. So the theme for this year's Hand Washing Day is hand hygiene for all. Hand hygiene for all, which is very timely given the unprecedented pandemic ravaging the world currently have. Hand washing has gained a new focus and meaning in the last 7 months or so due to, of course, the COVID. Indeed, the silver blue bullet in beating the spread of COVID-19 is hand washing with soap and water. Of course, along observing other measures as guided by the Ministry of Health. The theme reminds us of the need to take immediate action on hand hygiene across all public and private settings to respond to and control the COVID-19 pandemic. It also reminds us of the need to build on the current momentum to make hand hygiene a mainstay in public health interventions beyond the pandemic and create a culture of hand hygiene. So to walk the talk, today, Rekit Benkiza, known as RB, we actually announced a grant of Kenya shilling 70 million to water.org. This grant is to help more than 10,000 Kenyans, households in Kenya, access clean water and sanitation. These funds are savings, they're actually our savings from our travel budget for this year, given that global lockdowns greatly curbed business travels, forcing businesses to work remotely, to actually work from home. So these funds will be used in partnership with Kenya Women Microfinance Bank to provide affordable small loans to communities, especially in informal settlements and rural areas, to pay for water and sanitation improvements. The interventions include paying for water connections, buying water tanks, installation of rain harvesting infrastructure at home, or building a toilet. Beneficiaries will pay off these concessional water credit facilities via daily or monthly repayment arrangements. It is estimated that nearly 40% of Kenya's population still relies on unimproved water sources, such as ponds, shallow wells, and rivers, while 70% of Kenyans use unimproved sanitation solutions. These challenges are especially evident in rural areas and urban slums. So for the past 15 years, RB and Dettol have been at the forefront of promoting proper hand washing techniques. And this has become even more important now with the COVID-19 pandemic, which is spread through person-to-person contact. In those years, we have come to find that the biggest challenge has been accessing clean water sources. And it is for this reason we felt it was imperative to direct these funds to this noble cause. Our partnership with water.org will not only seek to provide water financing solutions, but we will also work together to disseminate information to the community on proper hand washing and the benefits of access to clean water and sanitation. Access to water and soap should go hand in hand with training to cause behavior change. We are also grateful to the national and county governments for putting in place regulations and policies to promote setting up of hand washing stations at public places, such as restaurants and markets, in the fight against COVID-19. It is our players will come together to finance access to clean water and sanitation. We believe in a win-win partnership model of national financing rather than handouts as a sustainable way to empower households in the sanitation war. I look forward to continued partnership to make hand washing a reality for all in Kenya, across Africa also, and the whole world indeed. Thank you all. Asanteni sana. Thank you all.
All right, thank you so much. Another round of applause for...
All right, now, let's appreciate our boss. Come on, guys. Come on, guys. I know we are tired, but we're about to do something very special. So I'd like to request a representative, I'm hoping it's you, sir, from KWFT and water.org to come on the front. We want to take a picture. There's an announcement that, let's appreciate them as they come. Mr. Obinja, as you explained to us about this.
So there's a partnership that has been entered into that they say is not only about provision of water, but of course in every partnership there's always some sense of monetary transfer. And like I said, in God we trust, everybody else you bring verified data. So we are going to show you the data to signify the partnership. And that is the check you're seeing right there. Round of applause for them as they come through. And this is also the best photo opportunity. Yes.
Come on, guys, let's appreciate.
On this one, a standing ovation would be better. Mnaweza simama nyinyi wote like the president is here.
Yes.
Asanteni sana. That way you also get off the fatigue a little bit. Simameni as we get the best pictures for that. And that would be amounting to 70,824,126.
We can do better than that, guys. Let's appreciate.
Yes.
Wow.
Another round of applause for that. 70,824,126. After him tutatupea namba zenu zote za M-Pesa.
Tafadhali tujuane.
Tumia kakitu. Kila mtu atajitolea mwenyewe, hakuna ya kutoa. Another round of applause for that as they get the best pictures for this partnership that has now been announced between RP and water.org as well.
So I think also while they are still there, I can call the first panel that came on stage. They can join the picture.
Yes, as the pictures continue for that particular one, okay, you can also talk a bit, agree on how much you're going to spend it. This is just the photo op. So when I see you talking, then I take better pictures. Mnaweza agree, mtanigawia ngapi hapo? I think from me hapo ikuanzia hiyo 824,000 si mbaya sana.
Hii ya mwisho.
Chipukizi apewe hiyo 26. Hiyo 26. Thank you so much. I hope you have the best pictures for that. All right. Asanteni sana. All right. Then now we'll call upon the first panel to also just jump up and take pictures. Asanteni sana. Thank you so much.
Thank you so much. Thank you so much, sir.
First panel, this is just a photo opportunity. If you're still there, kindly just come and line up here. The first panel.
Make sure you have your mask.
Dr. Kefa Ombacho, ensure all your mask is there. Director of Public Health, I think he has stepped out. If you're still here, first and second panel, I think we should just go up there. Sorry. Yeah, just back up there.
Just come up.
Yes. Just it's a photo opportunity to make sure ulikuwa hapa, like we mentioned. Yes.
Walimu, you can
all
come.
The panelists, all the panelists.
Walimu, you can come.
All the panelists, karibuni sana. First and second panel, pandeni tu juu. Yes, there you go. Ensure the social distance. Ensure you have your masks. Again, verified data is very important. This is the point where you smile in as much as you have your mask on. Smile. Thank you so much. Brilliant. Keep the smiles, keep the social distance there.
We can't see your
Take a
smiles,
picture.
but smile anyway.
Smile too.
Yeah. Camera guys, when you're ready, when you have what you want, you tell me.
There's always a selfie that we all have to take. Chipukizi ingia huko ndani, huko mwisho.
Ingia hapa ndani.
Yes. Tuone vile itafanya. There we go. We have everyone
Itakuwa
there.
kesho Daily Nation hapo mbele.
Nice. Ndio. There you go. Brilliant. All right.
Thank you so much. So while I have everyone standing and everyone here, because now we've had a good conversation, we've had a good day, I'd love to, DJ, if you have Jerusalem, these guys, these ladies and gentlemen, I'm telling you, they can Jerusalem for you. Let me, hold this one for us now. Yeah, I'm here, but I'm following you guys. Find your space. Everybody, how you do it? Because I know you know.
Ngoja kidogo. There's another picture here. Kuna ingine hapa nimeambiwa.
Yes.
Hii sasa ni selfie ya kamera. Yeah. Tunafaa kuishika. Then as well ingieni kwa hiyo picha tena.
Okay.
Yes. There. Just move closer, move closer. Move closer. There. Nice. Thank you so much. Haya, Jerusalem iendelee.
Haya.
For those of us who have two left feet, we will
So,
stand
ladies and
aside.
gentlemen. These guys have danced in Somalia, in Uganda, in Nigeria, and now they're about to shock you
The
with
best
dancing
dancers
moves.
we have. These are the best dancers we
These
have.
are the best dancers we have. Let's go. Starting from here. Show them.
Yeah.
Show them. Show them. Show them. Let's go. Hi, yeah, 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 yeah. They are dancing to the words, but it's fine. Oh.
Chipukizi is dancing on the inside. There you go.
You know, I'm just like them. It's just like, there's no difference. I have my colleagues. Okay, DJ. Guys, let me teach you. Let me just show you. No. You're embarrassing yourselves. And we have so much respect for you guys. We're just going to do the simple one, eh? Just very simple. If you can't do this, please
Ile
never
Mugithi.
dance.
You
See why? If you can't do this, never dance in front of people. I'm not talking about you. DJ, give me.
Twende.
Twende. Please don't fall down. No, it's fine. It's fine, guys. It's fine.
Chipukizi gives up.
It's never that serious. But thank you so
Thank
much.
you.
Let's appreciate them one more time.
A round of applause for every one of them. Thank you so much. All right, there's still some food. As we wind up on this, we want to thank you for that successful event. We mentioned that the changes begin with you. And that is how we live it. You know, they say the human brain doesn't concentrate for more than 7 minutes. So again, the change begins with you. That's it. And you can have some food, and then you may leave at your own pleasure. Thank you so much. DJ, kwako.